Well, menopause is actually defined as it's been 12 months without a period, and you're the appropriate age, which is about 45 to late 50s. So you really don't know you're in menopause until 12 months after your last period. There is something called menopause transition, is what it's now called. It used to be called perimenopause. And that starts 2 to 3 years before your periods quit. And what usually starts happening is people start having some variation in when their periods occur. They may be a little early or a little bit late. And eventually they'll start skipping periods, which is usually 1 or 2 years before periods completely quit. So women tend to be really frightened of menopause. They hear all these horrible stories about women who greatly suffer through that time. It turns out that about 75% of us will have some hot flushes or night sweats, but the majority of women don't suffer with them. The majority of women notice them, and it doesn't affect anything in their life except to notice them. It's really only 15 to 25% of women who suffer enough that they seek help from a healthcare provider. I always like to think first about non-medical things. The most important things are if you smoke, quit smoking. Exercise is a really big help. It also helps sleep, which helps us to sleep through some of our night symptoms. There are also a lot of meditative or relaxation practices which make a big difference for symptoms. And so things like yoga, meditation, massage, they're all great anyway, but they really do, they're great studies, they really do help these symptoms. One of the best ways to control hot flushes when you feel one coming on is to actually stop and do deep breathing or some kind of relaxation. So basically, as you start to feel a flush coming on, just taking really big breaths and actually breathing all the way down into your abdomen, and filling your abdomen and doing 3 really slow breaths like that, blowing them all the way out, will often stop a hot flush or at least shorten it and make it less severe. We know that most of the risks of hormones actually come after about 10 years post-menopause. So these days, when we start the hormones actually at menopause, specifically for symptoms, the majority of women don't have significant increase in risk. It's certainly a discussion to have with your healthcare provider because there are women who should not take hormones, and there are a lot of non-hormonal things we can do for flushes and other symptoms of menopause. But I wouldn't completely rule it out if you really are affected horribly by your symptoms. The most common condition would be vaginal dryness, which is really bothersome for at least 80% of women and very easily treated, and you should get help for that if you're having it. Other things include changes in our hair. A lot of women notice changes in losing hair, which is highly genetic, and also a lot of us start getting more dark, coarse facial hair like men would have, which is called hirsutism, which is really common and again can be treatable. So the most important things are to remain healthy, stop smoking if you smoke, eat really healthy foods in healthy amounts.